Hi everyone, good day. I'm here to demonstrate to you how to accurately measure your blood pressure. First is, what is blood pressure? So blood pressure is the pressure exerted by your blood through your artery. So you have your diastolic pressure and your systolic pressure. So first thing to do is to introduce yourself, give your name and your role. Next is to confirm the patient's name. So let the patient state his or her name and his birthday along with his age. So next is you need to explain briefly what you are going to do, the procedure you will perform to the patient. Next is gain consent to proceed with the recording observations. As you're done gathering the equipment, your sphygmomanometer, your BP cuff, your BP apparatus, and your stethoscope. So make sure your equipments are good, conditions are good. Okay, so now let's wash our hands, then you go to the patient. Alright.
Come in.
Sir, mayong hapon, ako si Noel, ang imong medicine student nga second year karon nga magkuha sa imong BP. Nana ba kay napermahan nga consent, sir?
Right.
Nara. So, meaning ani sir, nisugot ra ka nga mag-video ta karon para sa akong demonstration magkuha og BP. Okay. So, sir, usapan, unsa dito atong ngalan?
Elmer Almilor,
Elmer Almilor. Okay, so ano sa imong birthday, sir?
February
Okay, sige. February
20,
20,
1963.
1963. So, February 20, 1963, it's patient Elmer. So, karon sir, magkuha ta og BP. So, atong ilang taon ang pressure sa imong dugo kung di ra ba ka high blood or di ra pud ba ka ubos og BP. Okay? Sige. Wala na ba kay laing gibati ron, sir?
Wala.
Wala dili ra labad imong ulo, sakit yan, dili ra pod.
Wala.
Okay, sige, maayo. Sir, matod pa, wala ka nag-inom og kape karong hapon na?
Wala.
Wala ka gikan galakaw?
Wala.
Nagingkod na kada ilang
Wala
taon
TV.
TV. Sige sir. Sir, pwede na ako ipa-off kadjut ang imong TV or pahinayi lang ang volume? Sige. Salamat sir. After asking those questions, you need to position now your patient. So if the patient is sitting, you need to position the feet of the patient flat on the floor, not crossed legs. Because if the patient will cross his legs, there will be a false increase in the blood pressure. Sir, may I also ask to free your upper arm from any clothing? Can I roll your shirt, your sleeves? You also need to place the client's arm rest on an armchair or on a table, which is heart level, so that the elbow is slightly flexed and the palm facing up. Okay? Because the brachial artery is below the heart level, so meaning the blood pressure is high. But if you position your brachial artery above the heart level, so the blood pressure is low. May I also ask to have your feet on the floor, sir, flat on the floor? Okay, thank you. So are you comfortable with that position, sir? Okay. Now next is to position the cuff around the patient's arm. So the cuff has a lot of measurements, so depending on the size of the patient. So the width should be at least 40% and the length should be at least 80% the upper arm circumference of the patient. So you need to place the center of the inflatable cuff over the brachial artery of the patient. So your brachial artery is found slightly medial to your triceps brachii tendon. So you can palpate it there. Yeah, I have my brachial artery there. Next thing to do is to estimate your systolic blood pressure. So you need to palpate for the radial pulse. Then next is to inflate the cuff until you no longer feel the pulse. So once you cannot feel the pulse anymore, you note that measurement on your sphygmometer. So that is your rough estimation of your systolic blood. So let's estimate for the systolic blood pressure. You need to palpate the radial pulse until you can inflate it until you can feel no more pulse. So the estimation is 120. So deflate it and wait for 15 to 30 seconds. So this is to avoid unnecessary inflation of the cuff that would cause discomfort to your patient and pain. Also avoids occasional errors caused by your auscultatory gaps. So this is a silent gap between your systolic and your diastolic pressure. Now after that is, after you have taken note of the estimation of your systolic blood pressure, you deflate the cuff and wait for at least 15 to 30 seconds to do the blood pressure taking. So next step is to position your stethoscope over your brachial artery. So here is my stethoscope. So your earpiece should be, the ear tubing should be the same way with your ear canal, so that you could clearly hear the Korotkoff sounds. And you will use the bell. So this is the bell, because Korotkoff sounds is characterized by a low pitch sound. So the bell would amplify that sound so that you could hear clearer and you have accurate measurements. After you properly position your stethoscope over the brachial artery, you need to reinflate the cuff. So reinflate the cuff with additional 20 to 30 mmHg above your appropriate or approximated systolic blood pressure. Pressure, you need to add 20 to 30 mmHg. So inflating. Okay. Sir, your blood pressure is 120/80. So you have 5 Korotkoff sounds that you would hear when measuring a blood pressure. So your phase 1 is the sharp thud. The next is your swishing sound. The next is the Korotkoff sound 3 is your softer thud. The fourth is the muffled sound, and the fifth is the silent. So the first and the 5 is the most important thing to remember, because it symbolizes your systolic and your diastolic. According to the GNC 8 and American Society of Hypertension, they mentioned that there are 4 classifications of our blood pressure. So first is our normal pressure, which is less than 120/80. So next is our pre-hypertensive classification, which has a systolic pressure of 120 to 139 and over 80 to 89 mmHg. So stage 1 hypertension, these are patients having a blood systolic pressure of 140 to 159 mmHg and a diastolic BP of 90 to 99. And we have our stage 2. This is classified as the blood pressure having more than or equal to 160 over more than or equal to 100. The systolic and diastolic pressure doesn't fall in the same category, so you choose the higher category. For example, 120/90, so that is considered a pre-hypertensive patient. Okay? If the blood pressure measurement of your patient you have taken earlier is hypotensive or hypertensive, so you need to reconsider of rechecking it again after 2 minutes. Maybe on the same arm and also on the collateral side, so on the other arm also, so that you could rule out if the patient is really hypertensive or hypotensive as of the moment. So sir, akong kuha na mo nga dugo is 120/80. So meaning ana sa atong libro ang imuhang dugo na ana sa pre-hypertension. So karon ako lang gihangyo sa imo nga maglikay na ta sa parat sa di na kay ta sa mga matamis nga pagkaon o kanang di na kay nang kung mukaon magig karne ginagmay na lang. Okay?
Okay.
Sige. Then, pwede po ta nga mag-exercise si Nainay, ginagmay lakaw, mga 30 minutes nga lakaw, sa mga gani. Sige ha? Okay, salamat kayo, sir. Sa imong time nga gihatag karon, maayong adlaw. That would be all for today, folks. Thank you for listening and have a good day. Bye-bye!